is the concept of country ownership, and we can extend that to continental ownership. How well integrated has the continent been in ensuring that the reflections at the highest levels inform the conversations? I'll give you an example about some of the intractable challenges that we face. The money bit is a big one, and I think there's a lot of comments that have been made about that. But I'll give you an example of human rights, for instance. I think it may not necessarily be the case across all the global health institutions, but if you look at HIV, for instance, one of the things you would have to deal with at the moment is things to do with human rights. I'm sure that respect for human rights is handled in such a way that, in this case, the African continent is engaged from the top, basically. It's diplomatic conversation that needs to happen nonetheless. Again, issues around sustainability. There are countries where, and you'd find the implementing partners, in some cases that's granted. Maybe there are weaknesses, but even then, 20 years down the line, and you still have international firms that are implementing programs. What are we doing with building local institutions to be able to address their own issues? And finally, my comment is what I think is probably a missed opportunity. It's about to hear the rationale. I haven't seen PEPFAR represented into this conversation. In my opinion, it's one of the biggest global health initiatives, and I would think it's a really missed opportunity that we are not able to actually through what's happening. I know it's a bilateral, but it's a global health initiative nonetheless. I said finally, but maybe final. Just one more thing. And this relates to observations that we've noticed from the Global Fund perspective, and I think it extends to other global health institutions. And it's representation of implementing entities on the boards that are there. Yes, and I think this is important. There's been inclusiveness. The continent, for instance, is represented 2-3 seats. The Pandemic Fund actually has, I think, 4 or 5 seats on the continent, which is important. But how strong is that representation? Are we actually investing in ensuring that that representation is strong enough? I'm aware that donor countries, for instance, if you have a representative, that person has 20, 30 experts behind how they argue in those conversations. Are we that deliberate in ensuring, for instance, that Africa is also that adequately represented and ensuring boards? So, thank you, Chair.
Thank you very much. Thank you very much for your comments. Right. Okay. So I think there are fantastic comments, and Madame, you have asked a lot of important questions. We won't be able to answer that in a couple of minutes. Part of the answers I delivered this afternoon in the video that we suggest that we will come to. You have heard a lot of pool fund and so on, but that's not the only solution. There will be the multiple solutions offered. It's much richer, the vision we want to offer. So I think let's wait. In terms of methodology, you talk about the sample, the language we use, a very short presentation. It was a disaster squeeze that in 20 minutes. We're going to have the time to write all the findings. There's a lot of fantastic and very strong quotes we're going to put back in the report. So you will see that the report and the language we will use will stick to what we have heard and what has been shared with us. So we will, we can promise on the on this side that as researchers we will stick to what we heard and what we shared and what we have been shared with us. So and I will we'll sit down with you today and then at lunchtime and do as well the methodology we have conducted and selected the key informants as well. Without waiting, and Dr. Roos, I would like to leave the floor to you and this is we are in fantastic opportunity to hear about this initiative in Ethiopia and to learn from that as well. And please, Dr. Roos, floor. For 10, 15 minutes, you can, as you wish, you're free to, okay?
Yeah, thanks. So it's a morning, right? Good morning, everyone. So I'd like to start telling you all to Ethiopia. We came all the way here to this meeting, and I would also want to congratulate the FGHI co-chair, steering committee members, and the study team to the work that we have been doing to this end. I'm glad to hear all the presentations and the discussions. Saying that, I will be briefly reflecting the Ethiopia's experience with the FGHIs. As it has been said in some of the presentations, FGHI support has been resulting in remarkable achievements in the health system. Just to give some figures, we have been able to reach for a maternal mortality ratio of 267, which is, this data is from the UN integrated data, which we were used in 400s in 2017 and even in 800s in the past 20 years. And when it comes to neonatal 26, which had a big figure in the last 10 years, 39, underparent mortality from 123 to 47, infant mortality from 77 to 34, and with all the reductions of incidence of TB, malaria, HIV, and mortalities related to that, and with achievements to the contributions from the FGHIs. And